Welcome, everyone. Um, Happy you're all here. I was hoping to have some information about the Harbor School, and it might still come in while I'm on this call because I was told that there was going to be an update. I guess I'll just launch right into that first. I can't see this agenda yet. Did you send it, Jen? I thought I saw it come in.
I just need to know. The first item about the vaccination for teachers.
If it's all right, let me just do the, I'll do the Harbor School discussion first quickly. I just pulled it off the whole March one. As you guys might know, there was a lot of discussion about the pool for the Harbor School that has been promised for 10 years since they moved that school to the island. And I sense that there was a little bit of a cat and mouse thing going on between the trust and the SCA, which I think was the case. But I was concerned. I was concerned because it looked like it was going to be tied up in the ULURP discussions. And given the fact that the ULURP, I think, is going to take some doing before it gets laid down, I was concerned about it being connected to that, because that's happened to us before many times, where we get something that is infrastructure for our school tied up in the amenity distribution and the deals made around a ULURP. So I made a request to Margaret Chin, who was speaking with Alicia Glenn, to divorce the topic of the pool from the ULURP and reframed it as infrastructure and said that we need building 515. It's the only building that's going to house the pool on the whole island. They've walked the whole island. None of the other locations that Governor's Island Trust had been talking about were going to be sufficient. And so I went full steam ahead on that with the help of all of our elected officials, reached out to Kavanaugh's office, the mayor's office. We even have Nadler and Gillibrand involved now. So I did speak with Sarah and Claire Newman's office, and I feel like we're getting somewhere. So I just wanted to check in and give that update to you guys. Again, I had hoped to have more than that for tonight, but and it could still come in. But so that's all on that. And then I wanted to open for discussion and possible resolution. Teachers' vaccinations. And I think I'd like to start by asking, Dennis isn't going to be here, but Jeff is here. I wanted to start by asking Jeff what you know about how teachers are being led to vaccines. As you know, we passed a resolution to push them up in the line before our city officials, which was awesome, and it worked. And 38,000 of them have received their vaccine, but we have over 105,000 school workers. So it seemed like a low amount because they've opened a new tier. I actually got my vaccine because I'm a pre-existing condition person. And I was curious as to what the messaging is for teachers. Can you share that? Do you know that?
Yeah, so I've gotten both of my shots. You can hear me okay, right?
Yeah.
I have both of my shots. I got mine on February 4th and 25th, 3 weeks apart. The way it worked was we were told to, like, our union would the UFT had to fill out a form that was then would match you with a provider.
Uh-huh.
But if you didn't put on that form that you didn't have to be in school, you dropped to the bottom of the list. So I wrote to my provider directly and my healthcare provider, and that's how I got mine. But a lot of people get it through the union, and the union pairs you supposedly with a place. So people I know from my building have done it that way, and they go get a shot at a centralized location that's giving shots out. I don't know if it's just to teachers, but there are 2 schools, one in Queens and one in Staten Island. And they're like large schools, just have you make a time and you go there and you wait for a few minutes and you go in, you get it and you leave. So
Okay,
that's the best I know is that you kind of run it through a union pairing with you.
right. Can you see?
I would just say from my experience, since that didn't work for me, because I was honest on my form and said I don't have to be in my building, even though I am there every day. I wrote to my doctor and said, I'm a teacher, here's my credentials. And then they called me and said, we have a spot for you. So I think you might,
Why would it be an option to say they don't need to be in the building?
because they were trying to prioritize teachers that had to be in buildings, I guess elementary school teachers.
Ah, I see.
This is like 6 weeks ago, 5, 6 weeks ago.
I gotcha. Okay.
Okay.
So that's an option on the form to say you do or don't have to be in the building, and then it moves from there, prioritizing the ones that do.
At least it did 5 weeks ago when I started that process.
What is, as a teacher, what's your take on why we only have a third vaccinated?
Because probably only a third have to be in buildings. So if they filled out the form the way that I did, then they were not going to be prioritized.
I mean, to me, this is completely unacceptable. I mean, somewhere along the line, that was dropped. I mean, certainly it made sense for the first pass to get the ones, you know, vaccinated that have to be in school, but so much time has passed.
Yeah.
And now we're moving down to a whole group of people like myself that are now out getting these tests. And my concern is that we're going to run out of vaccines. I'm happy to hear that they have a dedicated place for them. Sarah?
No, so the form has changed, and because what I've been doing, I've been able to track the timing of vaccine appointments. So I reached out to Nest and I said, hey guys, anybody who hasn't been vaccinated needs help, I'll get you an appointment. So I was able to get a bunch of teachers and the restaurant workers around here. So far I was able to get 60 appointments, but it's a lot of time. And these appointments come in the day of, they open up the day of, and people need to be ready to go. So if I'm a teacher.
Why are you making appointments for teachers?
Because it's hard, and that's what I was going to say. It was hard for them to go online and get appointments. And so it's, for me, because I work on a computer all day, and like a lot of it sometimes are meetings where I could be listening to meetings and just like going at it, like trying to get an appointment. The system is not that easy. The system is not, and the hours these appointments come out, where there's abundance of appointments, the teachers are in school or it's late at night. So it's, I'm helping them, but the form doesn't say, it just says you're a teacher. It doesn't say if you're in school or out school. It's very, it's very generic form, the current form that I see now.
All right. So for me, I assumed that they were going to have something like the Javits Center for our teachers and even give them their own day where they would go and be vaccinated. The fact that they have to go to other boroughs is also unacceptable. Their schedules are so busy. And I am shocked to hear that this is happening because you know, for them to have to go through the same setup that we do as lay people to get this vaccine, I don't know about the rest of you, but that's impossible.
It is happening. Absolutely. It's a very it's difficult. If I'm teaching during the day, it would be impossible.
Yeah.
Hey, so were you able to get it in Manhattan, or did they still have to go to Queens?
So it's whatever opens up. So the appointments that I was pulling, it's the one that opens up. It's the Hospital for Special Surgery on 71st Street. There's one in Dumbo that always has a lot of appointments, and that's in Brooklyn. So that one also opens up, and the one on Broome Street. Those are the ones that I was avoiding. Staten Island, and the one that has a ton of appointments all the time is the 24-hour one in the Bronx
And Elmhurst. But I mean,
yeah.
I didn't think teachers were going to the same places that everybody's, I mean, I went to the Javits Center and it was really well run actually, but it was 2 hours. You know, I think teachers should be going in and just one after the other being vaccinated. They have things to do. And I think that was the whole point of our resolution, pushing them up to be vaccinated first before the general public. So, you know, I'm open to hearing from anybody else that knows about this or has questions about this, but I'd like to write a resolution about this. We need to get the kids back to school. At this rate, it'll be
Back to Jeff, like what is the union doing to help centralize this?
That's what I was saying. It's all, you fill the form out and then they theoretically pair you with a school. I mean, pair you with a provider. And some of my teacher friends have been paired with providers near them and been very convenient
Oh, it has been convenient?
for some of them.
Oh, good.
But they also do it in a way that's really, I mean, this is, I don't have data from a week ago, and my stuff's from 4, 5, 6 weeks ago when I was going through it, and so were some of my colleagues that I work with every day and see. And they would send you a time-sensitive email that you don't always look at the emails from the union, saying like you have till tomorrow at 4 o'clock to make your appointment. So if you miss that, then you go back to the start over again. So
Right.
I don't.
Okay. Well, that's good to know. Maybe we do.
Also, just in terms of information for you to have, I do think the teachers are allowed to take the time to get their vaccination during the school day. That there's nothing can happen to them in their schools if they take the time to go get it done.
Well, that's great. I mean, I think that is perfectly reasonable.
Yeah, I'm just saying, just so you know, there is an attempt to work around how busy they are by saying you can take school time to go get it done.
Okay.
Is that tracked just school by school, or is it the union, or who's tracking what percentages? Where did you get that number, Tricia?
I got it online. I can't tell you exactly the source now that I'm talking to you. I was looking really quickly just to see. Actually, I was in touch with Kelly McGuire. We were having an email exchange back and forth, and someone had told me that that was the amount. And so I wrote him and I said, is there any reason why there's only 38,000 vaccinated? And he wrote me back saying, where did you hear that? And I said, someone just told me, but let me go online. And I saw that it indeed was 38 to 39,000. Now, it's a couple weeks ago. So that could be updated by now, but it was still really what I felt to be a pretty low number, given all the efforts to get them out in front of the rest of us. You know, what do they did 250,000 in the last, you know, several days. Like they're really making progress. I mean, I know a lot of people that have had their vaccines.
Right.
So
You're right. There's a lot of people that I know that have gotten it. Unfortunately, you know, I've heard it's frustrated, but I know that even there's Dwayne Reed right on in Tribeca. They do day of if you're over 65.
there's a lot of locations if you're over 65, but that's the only demographic they're taking. And they're hoping to get to the older people, you know, like IPN and buildings that have a lot of our older people that can't get to these other locations, is what somebody told me. There's like 7 right here, like in Tribeca and Fidei and Battery Park City, but they aren't open to teachers.
So it's not. That's the thing, is to push the idea that if teachers have a valid, you know, form or whatever it is, they can go anywhere.
Exactly. That was going to be one of the points I was thinking on the resolution, is that they should be able to cut the line. They should be able to just take a voucher anywhere they want to go and walk in. How do you?
The whole school staff, not just the teachers, correct?
Yes. Yes, because I mean, what are there, 75,000 teachers, but there's 110,000 that are in the building. So
Yeah.
it really needs to be 110. We need to get them all vaccinated. So yeah, so I would like to do a resolution about this with that point, Wendy, that you just made about having a voucher as the way that we can facilitate it, because I think it's unrealistic for them to dedicate a location to it and it probably isn't going to be realistic or reasonable for any more reasonable than having to go to Staten Island or Queens if you live in Manhattan. So, so I think that voucher idea would be a great one, and that way
Or
we
just
can
proof,
some
yeah,
headway here.
proof work for the school, right? I mean, if you have a DOE employee ID, I don't know how that works. Jeff would know, but I mean, I'm sure everybody has an employee ID, and if it says you work for the DOE, you can get it.
Exactly. So I can't see any downsides to this. We've gotten through our most vulnerable populations, other than the older people that haven't been able to get to these locations, that I think will still be served at the same pace. I just got notice that Worth Street, we have one right here on Worth Street. They just opened back up again after running out. They now have tons up there if anybody's interested. I think we're now in a place where, you know, something like this could work and help expedite the situation and get our kids back. Jeff?
I love the sentiment. I just wonder how we as a community board, in just the purview of only our board, makes this happen. Because I'm not sure, like, I'm literally thinking, like, what if I weren't vaccinated and this resolution existed? Like, I'm not sure, like, for me, I'd have to go through, like, I mean, literally without boring people the details, I'd have to go through, like, mychart.org, whatever I use for, like, NYU, I'm going where I go. And like I did, ask my doctor for it and I sent my file number, which is the way that you can prove you're a teacher. And that's how I did it. But I don't know how that place would have heard about Community Board 1 making a resolution saying they can do that.
Because I think CB2 is going to do it, and I think I'm going to send this up to Kelly McGuire, and I'm going to see if CEC will pass it. Because I think we have to move. I mean, people are going.
I would say logistically, the way to make it really happen is you put one school in each board that is a mobile spot. Like the schools are reopening 22nd, high schools. So you could put a site to Richard R. Green down near Millennium by the Bull. And any teacher working in Community Board 1, I'm just giving an example, could go there during these hours and get vaccinated. You could do this by in the schools themselves if you want to make it very convenient. You put the, you know, teachers travel to that school in their teaching district where they teach. That's the way.
The only problem is then you're asking for new staff that can give the vaccinations to be approved in lots of different schools. I had thought about that initially, but when I got to the Javits Center and saw that we were dealing with the Army, and we're dealing with people who aren't even living in New York. They have called in so many, they've called in resources from outside of New York that asking for more resources I felt would be problematic and cause delays. Whereas if we use the resources we have, including the Javits Center, which by the way moves really quickly. I mean, they have probably 60 vaccination tables. It's pretty remarkable how many people they can process in one day. So if you had this voucher, you just go, it's just like the older people, make it easy, you know, just walk in.
Maybe if you ask for a certain number of percent or whatever at Javits Center be dedicated to that, you know, because what I like about your idea is you're trying to get ready. I would have somewhere in there, if I were you, something about getting ready for the fall, because the idea is all getting ready for the fall. And you have 5 months. You have 5 months to get vaccinated.
If we can get teachers vaccinated in the next 2 or 3 weeks, Jeff, we might be able to go back earlier than that. You know, I mean,
I don't think so.
Trisha, can I add a possible?
Everybody would.
Judith?
Oh yes, thanks, Trisha. I just wanted to add a thought. It's on the same topic, not directly related, but has anyone given any thought to our high school students that are between the ages of 16 and 18? I mean, have we thought about asking if they be on a priority list? Because there is one vaccine that's for 16 and up. And I just think it would be helpful if we had students vaccinated as well as teachers.
Absorb that in-house, how we would be able
I have not heard of a vaccine for
with the equipment.
whoever has background noise. Can you mute yourself?
It's
Um,
either the
That's the
Pfizer or
Pfizer. So the
Pfi-
Pfizer 16-year-olds can take it. And I know 16-year-olds that have underlying conditions that have already taken it.
okay, so I mean, we could add that to it, therefore be it resolved. But honestly, the teachers are the ones that are vulnerable and the most vulnerable, I should say. There are kids who have gotten it and had a hard time for sure. But our
Right,
teachers are the
but
most
the
vulnerable.
students being vaccinated also protects the teachers. So I think that, high school teachers would probably be happy about, half their students being vaccinated if it's possible.
Yes.
I agree. And I think that that is definitely a tier, but I still feel as though we should focus on, I mean, the teachers are not in school because it's not safe for them to be in school. And so whatever we need to do, and I mean, it's the beginning of March. I could envision a world where this is done in March and we go back to school for 3 months. I don't
Yeah,
see any reason why we can't.
I totally agree.
It's
I
very
think there are
cute.
probably some teachers who, for medical reasons, can't get vaccinated and would probably appreciate having the students vaccinated. So I just throw that out there. I mean, I
It's true,
agree.
but
The
if it's
teachers,
only 16 to 18, do you think they'd be willing to come to school? You know, if it's just our juniors and seniors?
I think
I,
it's just, go ahead, Jeff.
no, you go ahead. I'll go after you.
I just think there are some teachers who probably can't get vaccinated. And so this is extra protection for them that at least half of the students are vaccinated. It certainly slows the spread down. I
Sure.
think that there are some, parents that are holding their kids at home because they have concerns about the virus. I think it would probably help those parents get comfortable in sending their kids back to school. I think, it doesn't have to be in the same tier as the teachers, but maybe it's a tier right under the teachers. Maybe it's as soon as, we open it up to the next tier that we should have 16 to 18-year-olds in school be in the next tier. So just,
Well, I mean,
food for thought.
we're already in the tier of pre-existing conditions. So if we're going to do it and we're going to push to, I mean, the reason to push and not have teachers just get vaccinated whenever they can is to open the school before the fall.
So I'd like to address that. I won't be voting for this resolution if that's in the wording of the resolution. I don't think the idea is to open schools fully before the fall. I think the idea is you got to recognize the challenges to open schools before fall. I think the push right now is to get everyone ready for fall. And the schools are going to open partially in 2 weeks. And some schools like mine would just not be able to have, we have to move kids on elevators if we're not the only school like that. I'll just give you one example. Our school, there still has not been, by the CDC, a complete removal of social distancing. You can't have that many kids in a classroom. I would just say, I think the push here is to be diligent about getting everyone ready for the fall. And that's the only wording that I would be able to vote for this under. I don't think that it's about trying to get everyone ready to start in 3 weeks or a month and a half. I think that I'm just saying, I think it's about trying to get, if there are 100,000 people, you're gonna have people who are like, I don't want to do it. You're gonna have, like you say, there's gonna be people on safety agents, school lunchroom workers, counselors, nurses, like everyone has to get vaccinated. Plus the kids have to start getting vaccinated. The kids can carry it and they can carry it amongst themselves and then back home to their families. This is still deadly times. We're not ready for a full reopening. That's my 2 cents. I'm not interested in reopening before fall.
I think that we need to be worried.
So-
I do think we need to be worried about the fall. I mean, just putting sort of both of those points, as those differing points aside, I do think we need to be worried about the fall, because what they're saying right now is we might be hybrid in the fall. And that to me is really concerning, because
I thought DeBozo said yesterday that it's 100% back. I mean, de Blasio said that he would be 100% in person in the fall. I thought he said that yesterday.
Did he say that?
Yeah, and that's what he said yesterday. So that's what I'm going with, and that's what I'm like. My head is just going to be there. So
I'm gonna look that up because I heard that it wasn't decided yet, which was
no,
very
I thought,
concerning.
no, I mean, that would be very concerning. That's when we definitely start looking definitely at that point at private if they're going back in person. But um, just to go back to Trish's point, I think focusing on getting teachers and the school staff vaccinated is something important because next week they're opening it up to all of like the building workers. So everybody at Union, the 332 JB, they have now priority. So they're extending more and more starting next week. So I think getting teachers as a priority right now is something that we just need to be focusing on more than anything else.
I mean, I'm willing to keep that out of the resolution, but I still maintain hope for it. I think we have a mental health crisis in New York City right now that the things I'm hearing are so terrifying that unless we do something soon and different than what we've been doing, then I think we're going to be in trouble. I haven't heard the announcement about sports. I don't know if anybody else has.
They said it's starting also. They made that announcement with the school and the high school and the sports starting at the same time.
Yes.
So not till the fall?
No, no, no.
Starting
high
now,
school,
starting in 2 weeks, PFA sports
Good.
resume.
Sports
No,
is in April.
no spectators. No spectators wearing masks, and will continue into the summer.
All right, well, that at least is good. I did not hear that, so that's
But I
great.
don't know how that works. If you've signed up to not be in school live, how can you be in a sport live? I'm wondering how they're going to handle that. So you don't go to school live, but you get to be on a team.
They just, that's interesting because they just gave everybody that chose remote the option to do blended again. After hearing this news, it wasn't supposed to be one of the junctures you could choose, but that's great. And I think, for the kids who want to do sports but don't want to go to school 2 days a week, I would imagine that they're able to choose that.
Wait, where have you heard that they reopened the option to go blended learning? I've not heard that.
I haven't heard that one.
That's not true.
When the high school's open.
No.
No.
Heard that either,
Not
Trisha.
at
In
all.
fact, I heard that people
Only
were
the
really
kids.
worried.
Only the kids who've already signed up for blended learning can return.
No, my
People are
daughter
really
said,
upset about it.
my daughter said that at weekend they had offered them that.
No.
Maybe she misunderstood, but
That's not a policy.
Yeah.
That's a major policy thing he's addressed, saying maybe, but not for now. Now it's if you're already in, you're in, and that's it.
Yeah, it's very
So when they
troubling
open
because a lot of
schools-
students would opt to go back if they had the chance, and I know that people are upset about that.
yeah,
They've got to reopen with who's already there and figure out how hard that's going to be. And then I anticipate they'll do a further opening the door. And as a teacher at Millennium, that's going to be nightmarish, but it might happen.
yeah, I do think it's nightmarish because for scheduling, I'm sure to have to change what you're doing now in the middle of the semester will be difficult, but I did hear it was a possibility.
I've heard he wants to maybe make it. He said maybe down the road. That's not the way it's right now. It's not. Yeah, sign back up if you want to come back to school. That's not what's being offered right now. Only kids that were already blended can return to the building. Like Talon, I'll be able to see Talon 2 or 3 times a week.
All right, so getting back on topic, I will not advocate specifically or against opening school full time, but I am going to draft the resolution that will have the facts about how teachers are getting vaccinated now and make a recommendation that we both give our teachers and our 16 to 18-year-olds vouchers to be able to go to existing locations for walk-in appointments. And anyone have any other ideas they'd like to add to that?
Trisha, the only thing I just want to add is I understand that we're keeping it out of the resolution, the idea to open schools fully, but I have to go on record saying I totally agree on the mental health crisis. I'm hearing from so many parents. issues with depression. I know that suicides are up. It's the guidance counselors are completely overwhelmed. It's really such a crisis for these kids. And it's just terrible.
It is. I mean, I can have that just be a whereas. We had it in our last resolution. You know, I really do think it's about the whole deal. The blended learning is not fixing that, because the kids have to sit in one room and they're on computers for part of the time they're at school. They're not being taught live the whole day. So it isn't taking care of the mental health issues, which is why I'm, you know, very still fixated on getting our kids back full time. I think blended learning is actually harder on our teachers. I mean, Jeff has told us that before. I mean, it's really difficult teaching two ways. Oh, Sarah wrote about school nurses being vaccinated. They're in the 110,000 number. So yes, they'd be in that group. All school workers.
No, I was thinking that if they were going to do a vaccination program, they could let the school nurses do it.
That's interesting.
It seems possible.
If they're willing to be on site, you know, the site.
Perhaps integrated with the blended learning.
Say it again, Taylor.
Perhaps like integrated with the blending learning,
Exactly.
maybe having kids already in the building.
That's what I think too. Yeah.
Yeah.
That'd be a
That's
great,
good idea.
that'd be a great, you know, whereas healthcare professionals in the building who can administer, well, I don't know if
No.
they can administer injection though. They can't even give you Advil. I don't know if they can give you.
Are they
No,
allowed to-
and the other issue is the only one that so far the 16 can take is the Pfizer and storing it. I don't know if they have the capabilities of storing it, and that has been the issue. There was discussion of doing that. Like, the one that is going to be very readily is the Johnson and Johnson, and it's one shot. But I don't know if that is the kids can take it. That I don't have any information on.
Yeah.
I think that one is 18 and up.
Okay.
Yeah.
So maybe we stick to the voucher idea.
I would just want to be sure that none of the whereas is or be it resolves talk at all about an imminent opening. That's all I would say.
I'm
That's a separate
fine.
resolution.
I'm fine with not putting that in. I'm fine with the importance of opening our schools. I think that would be a natural whereas, because it would be the only reason for the urgency.
I would like the language to say to prepare for opening our schools, because I mean, opening our schools is sort of a backdoor way of trying to imply you want them open like imminently. And that's a separate resolution. We're not calling on schools to reopen imminently. I think this is a conversation about prioritizing vaccination, not reopening schools. And I think they're morphing together to become a very unclean resolution to me.
No, I'm fine with
What's
keeping
the
it.
what's the point of prioritizing teachers if we're not trying to get kids back to school? I don't get that.
I mean, if it were up to me, we'd say to prioritize teachers to get ready to and students to get open for the fall. Like by the fall, they have to come up with a vaccination for young kids for the fall. People have to be vaccinated to go into a building and carry a deadly disease that they can carry home. I don't know how you reopen schools if everyone's not vaccinated in the fall. Everyone.
Well,
So
they
then,
can't do anything.
yeah.
I mean,
Well, they
no,
vaccinate young people for all kinds of things. They've got to develop one that younger kids can get, because you can't let kids carry it around amongst themselves and bring it home and bring it into buildings.
what if it takes a year? What if it takes a year to develop a vaccine for kids? Are we not going to go back for a year? Another
I
year?
don't know.
I totally disagree. Transmission
I
rate in
totally
schools is
disagree with that
0.5
too. I have to say, I think, you
0.54%.
know what they told me on Johnson Johnson, which is the least effective vaccine, is that it's 70% effective. And I said, well, what does that mean? They said, well, you could get COVID, but you will barely know that you have COVID. And every adult that's vaccinated could still get the virus, but it's not going to put you in the hospital, like 0 cases. So for me, if the teachers, the adults, the parents, the pre-existing conditions, the people that could end up in the hospital are vaccinated, I am not concerned, nor will I be willing to wait for a 10-year-old to be vaccinated to send our children back to school. So that resolution will be coming if I'm still on this committee, because we cannot keep our children out of school anymore. And it really is, now we are looking at mental health versus physical health. And it's getting, there are serious milestones that are not being met by our children. I had my daughter's math teacher tell her he was not going to be able to fulfill the class that she is taking. She will have to go to summer school to be able to matriculate to the next level of math. I mean, can you imagine what we're going to have in terms of the have and have nots? Because you're going to have everybody that can afford it going to summer school this year, especially sophomores and juniors in high school that need certain things to apply to colleges they want to go to. And companies like Fusion are already completely overrun at $4,000 a class for summer, because you're not getting trigonometry if you're taking that this year, because they're teaching 3 sections of math instead of 4 a week at my daughter's high school. And everybody's just like, yeah, well, what can you do? Well, what can you do? We're not going to, our kids are not going to be prepared for college. So we're going to have to do something. And it's already been a year. And you can probably, you know, catch up at this point if you work really hard and the DOE offers some sort of summer programming. I'm really concerned.
And
more than just a little concerned.
And if we start talking about like kids and vaccination, then you're going to hit all the parents that anti-vaxxer, and then you're going to end up with a lot of issues. So for me, it's just, let's get the adults and the teachers and the older kids, whoever, right now, and try to open the schools as early as, you know, as possible. And within this group, we have the ability to try to do a lot for our kids. Not everybody, and I don't even want to start, because I will break down if I start talking about the mental health issue with some of the folks I know and in the outer boroughs and in the, so again, yes, we do need to get the schools open as soon as possible. And actually the bigger problem now is with the middle schoolers. They are having a very, very hard time. So let's just figure out a way to, let's just focus now on getting the teachers vaccinated, and I love this voucher idea. And if there's anything I could do with that, I'm willing to just to sit here and get appointments for anybody that needs an appointment.
Well, I don't want to
That's what I
set
do.
precedent, Sarah. This is not how we should be rolling. You know, we need to set up a functional system. I'm kind of amazed that they don't have something stronger than they do.
I'm desperate, Trish. I'm desperate. This is just pure desperation.
So I am fine to keep it as prepare for opening schools as soon as possible being in here. And then we can make another resolution once we see if this is effective and how many teachers and school workers are vaccinated in another month or so, another 2 months.
So are you saying, so you're saying you're going to have the language in there to do this, to open schools as soon as possible?
Prepare for opening our schools as soon as possible. No date. No, this year. I won't put anything in there, but it won't make sense if I don't say that, because otherwise they could come back and say, yeah, they'll get it. They'll be ready for fall. I do think it's important for us to see these milestones met, and for us to, you know, show the urgency of getting these teachers vaccinated. This vaccine's been available since December, and they are like the most important people, and we have a third of them vaccinated. So that isn't good. It's not a good precedent, I don't think. I would love to hear from more of our committee members, if anybody else wants to share something that's here. Anybody else on this? Any whereases or therefore be it resolves that we haven't hit? Anybody else want to share?
Oh, Trisha, I would just say, when you say prepare to, you know, open schools, I would just say fully open, because they are open. I mean,
yes.
And that's what I don't want. And I would say that's what I don't want in the resolution. Because that's saying it's what you're trying to do. You're trying to say you want the school. You're making a resolution about reopening schools, not about vaccination, which is
yeah, that's what it's about. It's about vaccinating teachers so we can fully reopen schools. That's what it's about. We have kids that are in crisis here. I mean,
Yes.
a friend of mine is in 10th. The child is in 10th grade. The child apparently has not been signing in at all. to school. The school called, and you know, if you don't see these kids in person, they don't exist. The school
Exactly.
called and said, your child's not going to finish 10th grade because they've missed so many classes. And the parents said, what are you talking about? My daughter's in her room in school. And the school said, no, she's not. I mean, we need our kids to be in school, and they need to interact with teachers, and they need to socialize. These kids are completely isolated. This has to
Until it's
stop.
safe.
Movie theaters are opening, restaurants are opening, gyms are
Well,
open.
I mean,
That's
liquor
percent.
stores,
say,
liquor stores.
100%.
The transmission rate in schools is 0.54%. Like,
Because they're not
this is-
open.
Of the
I-
schools that are
I was
open.
gonna say the hard part is that, you know, some schools like my son's school, the way they were able to do the social distancing is that his 10th, 11th, and 12th, everyone's home. There's no option to come in part-time. It's just not even an option. So that the middle school and freshmen, ninth graders can go part-time. So to Jeff's point, even if they open the school, they have no way to social distance if they have the 10th, 11th, and 12th grade. So, I mean, my
You
son's
just
like,
can't-
well, are they going to, what?
You just can't reopen the schools fully. The CDC has not said stop social distancing. Therefore, you cannot open schools fully. And I just think making policy based upon anecdotal thoughts of people we know and people in our lives is not how you make policy.
Okay.
I was just reading about vaccinations while we're sitting here. They're working right now to vaccinate children. Most health specialists in the 4 articles I just read said, until you vaccinate young children, you're not going to get herd immunity, and it's going to be lingering out there and continue. Just, this is a rough time. I get it, but we don't make policy because, you know, people we know are having a rough time. You make policy based upon how people infect each other. And we had 2,000 people a day dying 10 months ago. And we're out of those woods now. I don't want to go back to those woods. And so I just feel like I don't want anything that vaguely suggests in this resolution, we cannot reopen the schools fully until social distancing is withdrawn as a major initiative. And that's not going to happen in the next 3 months. So you can't put 34 kids in a room all day long every day. It's just not, it's not safe. No one in healthcare is advocating for that. No one, not one person.
Can we look at how Massachusetts were reopening with, they changed the social distancing, and we can just keep an eye on that and see how that works out.
They changed it from 6 to 3
Plenty
feet.
of schools that are
Yes, so that's what they've done. So we can just keep an eye and just see how that works out also, because if they reopen and there's no problem, then it's just something to look at.
All right, so I'm going to write this resolution. We can write that resolution next month. And if everybody feels strongly about it, we can gather data on the changes that these cities are making right now in terms of the social distancing and watch what the CDC recommends, and then regroup on how strongly we want to push to open schools right away. But for this month, we can focus on getting our teachers vaccinated with the whereas it says that because we need to fully prepare for opening our schools fully and prepare without a specific date. So that is what that whereas will say. It will say we need to prepare to open our schools fully. First order of business, teachers getting vaccinated. And only, you know, and then I'll throw the stats down of how many have been vaccinated through today. I'll dig around and find it and get the data together, and then we'll pass that resolution. I will send it out to you. In fact, I'll do it this weekend, so you'll have it well before the meeting to be able to weigh in. And we'll pass that, and then we can, you know, Judith, I sort of feel like you did. It's not anecdotal. We have a mental health crisis. I have half of my friends, children, in mental health crisis right now, 50%. That's a big number. And this is an affluent community with parents who are involved. And I can only imagine what this looks like elsewhere in the city. I have a friend of mine who also didn't know, close friend, didn't know her son wasn't signing in. These are at schools like Millennium. Like the teachers are saying there's a significant amount of kids who never go on camera, never sign in. All of the guidance is optional, which is, we recommended that there's non-optional guidance check-ins. Schools are not taking that advice. They're saying our guidance counselor is here whenever you need them, expecting 17-year-olds to go to them when they're in a crisis. They're not doing it. It's not happening. We knew it wasn't going to happen. So, I think that can be part of that second resolution that we do. But I think it's more than that, Jeff. I would argue that this is now a crisis that could get the same headlines that this virus is getting. And I'm really, really, really concerned about it. I am thrilled that sports is starting, because that's, I think, a really, for the kids who play it, I think that could be a really good start. But there's a lot of kids who don't. So we have that we're going to have to contend with. But I will keep this resolution without that recommendation for opening immediately. And Jeff, if you don't like it, you can offer a friendly amendment when that time comes, when I send it around, and we can discuss it.
Thank you.
But I think that whereas will be very much like I just said it would be. And if anybody else has suggestions for me right now, you can, I don't see any hands up. But if you think of them after we get off, you can send them to me as well. Share any other stories you want to on this topic. I'm happy to add any and all.
I was going to say, Trish, I don't know if there's any way that the schools, or if you could talk to Kelly, this is not something for a resolution, but when you're talking to Kelly McGuire, one of the things that deans had to go pick up books or something from time to time, not very often, but I mean, even when that happened, it was so unfriendly in terms of, he was so excited to go to school and pick up his packet. And it was, just so not, they're craving even a couple people to say, good to see you.
Mm-hmm.
And that's, it doesn't have to be the whole school going to a pep rally, but there's a real crisis, to your point, about talking to each other and, guidance or something else, setting this up so that there are social interactions, not just homework and not
Right.
just schoolwork. Because to your point, it is, it can be, it's just, that's the lonely factor, is that there's no, I'm really happy to see you. How are you? There's none of this going on, except for their family, which, at this point, no 16-year-old boy wants to hang out with his mother and father.
No. No, they don't. And it's, I hear things like, what's the use? And who cares anyway? And, when you start to hear that from kids, especially the ones that are in middle school and high school, going through all these hormonal changes that already have, all that angst to deal with.
And there's no summer jobs. All the programs are still canceled. I mean, there's not a lot for them that is tangible for them to understand what's next, if that makes sense.
That makes total sense, Wendy. It's
I
really,
just want to be clear in terms of all this, that my concerns are around health. As a father of a 16 and 11-year-old, I see 17 and 11 and 21-year-old, I see the mental health strain. And I'm not trying to belittle people's experiences by just calling anecdotal. I'm saying people have to also look at the science and what's going on, is all that I'm saying. I want my kids to be back in school. My daughter's very excited to go back to school a couple days a week. My son's very excited to be back a couple days a week. That side of me is very clear about being happy for them. But to me, I've written off this year. This year is just going to be a weird year, and we're got to get ready and be safe for the fall. There's no way to be safe in the next month and a half.
No, I agree with you, Jeff. I just wanted to say, that wasn't an option for my son. We didn't have the option to go part-time. It was just, everyone has to be home. And so it's a little bit tough for people, and, some schools don't have a part-time option.
Yeah.
So I'm not saying I'm 100% in agreement. Everyone has to do it safe, but there has to be other mechanisms to figure out ways to mental health, guidance to Trisha's point, or some other things to check in with these kids. So it's, it's a little bit richer environment. So
Yeah.
anyway, enough of that. Sorry about that.
These are rough times. It's pretty awful.
That's a really good point, Wendy. All right, so I think that's it. You've heard the points that are going in it. So I guess we'll just take a vote and then I'll send it around. Ben, do you want to do a roll call?
Sure. I just see from the attendance list a member of the public with their hand raised. I don't want to mispronounce her name, but Emily Uzin.
Sure.
I'm going to unmute you in case you wanted to say something.
Okay.
Hi, Emily, are you there?
Yeah, hi. I think there are two, I agree most of what you said, and I just want to add two things. I think for school to open right now, with the pandemic, we need to sort of think about how reorganizing the classroom and with the teachers, with the social distancing rule. Or another issue is, why can't we try to adapt our kids to some hours of virtual classroom using this particular opportunity? Actually, my grad school alumni friends, they were actually trying to experiment to reach out to their students through virtual classroom. It's an option.
Emily, I'm not following exactly. We do have virtual learning right now. Are you talking outside of the school day?
If we do let children go back to school, there would be an issue of social distancing rule for them to follow. And our classroom is also definitely not like 3 feet or 6 feet apart from one another. So there is a lot of reorganization to do, just the formation of our classroom. If we still need to wait sometimes for our classroom to be reorganized, then I would think some of my grad school alumni friends who are in educational fields actually are experimenting virtual classroom to reach out to their kids.
I guess I'm not following. How do you see that structure? With the grad students, what role would they play?
There are two things. There are two about opening or reach out to our students. There are two aspects. First, we need to have our school to be reorganized to fit into the pandemic social distancing rules.
It is right now. They are doing that.
Yeah, at the same time, we do not need to lose our students or our children. That's why I'm trying to tell all of you, my alumni friends who are in educational fields, they are actually actively reaching out to their students through virtual classrooms, like what we're having now. They're trying to either the other social media and as well as virtual meetings, kind of a combination of those to get children still connected to their teachers, to their schools.
Yes, I think that we do have that happening now, but I think what people are saying here today is that that isn't socialization, that really they need to see each other in person, and there really isn't a replacement for that. I mean, they're doing as good of a job as they can do with virtual connections. they're in Zoom classes all day talking to people face to face across the screen, but it's just not the same as being together. So, hopefully that can happen soon.
Right. However, this pandemic season is just a phase. It would pass, but however, before it passes, so we could adapt the two alternatives. That's what I'm trying to say. Thank you.
Thank you. All right, anyone else? All right, Jen, can you take us through roll call?
Sure. Can a member of the floor call the question and somebody else second, please?
I call the question. Someone's got a second.
Second. Thank you. So Tricia?
Uh-huh.
Yes.
Yes.
And for Jeff, someone unmuted. Okay. So for Jeff, since you're a teacher, you'd have to recuse yourself.
I will if that's required. I'm not sure it's true. I don't have any economic advantage involved in this, but we can find out later. For now, I'll recuse.
Okay. Sarah Tassel,
Yes.
Wendy Chapman,
Bring my agenda back up here.
and Kakudian,
Yes.
Taylor Monjovi,
Yes.
I think he has to recuse as well if he's a high school student, but I'm not sure again.
Oh, I do.
I think if you work for the DOE, that's the issue.
Donna,
But
can you
but
call
I'm
Sasha
not
and see
sure.
what she needs?
Yeah, maybe that's it. We can find out. We can clarify later.
She's calling me, so she has a question.
Yeah, okay.
Judith Weinstock, Judith,
Sorry about that.
no worries, and Andrew Zelter.
Yes.
Thank you, and Sarah E.
Yes.
Awesome, and this resolution passes.
All right, great. Thank you, everyone. Like I said, I'll be sending it around to you probably by Sunday night.
Thank you.
I have new business to remember before anyone goes.
Oh, that's right. Jeff has new business. Go ahead, Jeff, introduce.
So just to get the ball rolling, I think it'd be very empowering for our community to begin the conversation about renaming Stuyvesant High School. To name it after someone with a more honorable history than Stuyvesant, who has a storied history of anti-Semitism and various other fronts. And I would even have a proposal of who to name it after for another time.
I support that.
A suffragettess, is that right? Yeah. Or a suffragette named Mabel Lee. Incredibly interesting biography. Look her up, Mabel Lee, Lee, and put suffragette after it, and you'll learn all about her. But that's a little bit premature to start thinking about who to rename it after, but I do think we could offer a conversation about this amongst ourselves at our next meeting. You'll find her story absolutely amazing. She was part of a giant parade for women's rights to vote when she was only 16 years old in 1912. Her biography is nothing short of spectacular and amazing. And I think it'd be interesting to name Stuyvesant after an Asian American, considering its long history of educating many Asian Americans, and to begin that conversation since it is in our district, although it is a school that draws students from all around the 5 boroughs. Just for next time, food for thought. Mabel Lee, Mabel-Lee.
It's great. I mean, there's a lot of Stuyvesants in New York. It would start maybe we'd be renaming everything that's named Stuyvesant.
Yeah, and if you don't know much about him, go ahead and Google him and you'll learn all about put his name in controversy and start reading the horrible things he said about Jews, among others.
Yeah.
I had no idea, Jeff. Thank you.
Yeah.
He's terrible. He's really terrible. and hated, really disliked by everyone around him at the time too. So anyhow,
Thank you.
just throwing it out there. Another
We'll,
log on the fire.
we'll do our research and bring that back to the next meeting.
Okay.
All right, and hopefully I'll have some school news for you as well.
All right.
All right, everybody.
Uh,
Thanks for
All
coming.
right.
Bye, everyone.
Bye-bye.
See you tomorrow, Tailing.
Yep.
You all. Thank you.